Eye bags are a very big problem for many patients. Sometimes it's genetic and sometimes it's as a result of treatments that we do. So one is to recognize the eye anatomy. If somebody has what seems like an eye bag, one thing that I find is helpful is to press on the upper eyelid. If you see a bulge from below, then that's a fat pad. If you don't see it bulge more from below, then chances are it's just edema. So you have to be careful if it's edema, because if you put filler, you can affect lymphatic flow and that can make the edema worse. In those cases, we need to do things that minimize edema, like improve hydration, strengthen the skin, do tightening devices like Ultherapy to help support and strengthen the skin and improve lymphatic drainage of that area. If it's an eye bag due to fat, we can sometimes do injections in the local area. So sometimes it's right underneath it, sometimes it's in the mid-face to help draw it up, and in this way we can mask an eye bag. I would say one thing to avoid edema is when you're injecting under the eye, for the most part, you need to be either very deep on bone, and I prefer to do this with a cannula because the cannula comes in laterally. I can go right along the bone and put the product in, and I know it tends to stay deeper, as opposed to a needle going straight in where you might inject a little bit on the way out and it can end up in the fat. And if you're not all the way deep on bone, then be very superficial with a very light product like Bellaterra Balance, even maybe a little bit blended, and go more superficial. But if you're in the fat, that's an area of high lymphatic flow, and that can cause an increase in edema in that area.